Well, welcome everyone to today's webinar. We're going to be talking about power wheelchair training or mobility training. My name is Michelle Lange. I'm an occupational therapist in the Denver, Colorado area. I work with power wheelchairs quite a bit. I primarily work in pediatrics, but I do work with a wide age range. This information will be helpful for a wide range of ages, but is particularly pertinent to the pediatric population and someone who perhaps is getting that first power wheelchair. So this is what we'll be covering. We're going to talk about mobility training for the client who already has a power wheelchair. Now, there are some clients that perhaps aren't quite ready for a power chair yet, and you may want to develop the skills they need in order to be successful with a power chair, perhaps before that evaluation. We did a webinar on this topic. That was our very last webinar, called Developing Readiness, and this is basically pre-mobility training. So we have training for a client that does not yet have a power chair to help them be ready to use one. And then once someone has received that power chair, we do mobility training to optimize their driving, and that's what we'll be talking about today. You have two handouts that you received in your email about this webinar, so you can refer to that. One is a PDF of this PowerPoint. The other one is some mobility training guidelines for power wheelchairs, so feel free to use those. So we're going to start by talking about what the research says about mobility training. We actually have a tremendous amount of research about pediatric power mobility particularly, including why mobility training is important and just what strategies are going to work best with these populations. There is research that shows that many children, even those with significant and multiple impairments, can use a power wheelchair with appropriate training, support, and supervision. This is super, super important because we see some clients that are very, very involved and who have multiple impairments, meaning we have a client who perhaps has motor, cognitive, and visual impairments. That client can still often be very, very successful with a power chair. Again, if they have appropriate training, support, and sometimes supervision is required. Even if that means this person isn't completely independently mobile because some supervision is required, the developmental benefits of self-initiated mobility may outweigh that complete level of independence. This person may just need supervision for a period of time. So just like we don't send our 5-year-old off to the store to go buy milk, they need a certain degree of supervision. Same with many of the clients we work with. So again, these are specific studies that show that many kids with severe intellectual and/or sensory impairments, such as vision, can learn to use a power mobility device competently if they have appropriate practice and environmental support. So these are very important studies that let us know this is something we need to address when we're working with our clients. Get to our next slide here. So what does that mean for us? Well, many children, again, with severe intellectual and/or sensory impairments can learn to use a power mobility device competently if we make sure we provide appropriate practice and environmental support. Successful learning of power mobility skills may depend at least as much on the practice time and quality of learning support within the child's environment as the child's motor, cognitive, and/or sensory abilities. So these studies specifically demonstrated this, and I think these are so, so important. Listen to that again. The quantity and quality of mobility training matters just as much as what the child brings to the table. So it's so easy for me to focus on what is this child's abilities and limitations? What are they able to do from a cognitive, motor, sensory standpoint? And instead, I need to remember to also concentrate equally on the quantity of mobility training and certainly the quality of that as well. So mobility training optimizes driving efficiency. So even if the client was evaluated for a power wheelchair and one was recommended, this does not mean that further training isn't required. Mobility training often completes the evaluation. So once this child receives their power wheelchair, I need to watch how they're driving because I may need to make some changes in programming. I might need to tweak their positioning a little bit or the position of the driving method. So I'm really completing the evaluation and then launching into some driver's training to improve outcomes. So let's put this in context. Perhaps some of you have a teenager. Maybe you've taught them how to drive. Tell you what, I want to keep you awake. Go ahead and raise your hand if you can figure out how to do this on our Ready Talk platform here. Raise your hand if you have a teenager that you've taught how to drive. You know, teenagers have to get a permit. They usually, depending on the state, have to practice for an entire year with that permit, along with a parent who supposedly knows how to drive. Depending on the state, again, putting in between 40 and 50 hours of practice. And that's before even taking a test. Now, for a teenager, these teens have average motor, sensory, and cognitive skills. Again, for a teenager. They've also had modeling. They've ridden in cars their entire lives. They've watched other drivers their entire lives, good and bad. They already know how the car works. They know you steer with the steering wheel, you push that one pedal on the floor to go, and the other one stops you. So they know how it works. They've seen other people do it. They have lots and lots of practice before they can even take the test, because research shows us that without that degree of practice, despite typical motor, cognitive, and visual skills, these kids will crash into things. So that's why they're required to have a certain amount of time with a licensed driver. As opposed to our clients who are using a power wheelchair, many of these users do have motor, sensory, and or cognitive limitations. Many first-time power wheelchair drivers have never seen another person use a power wheelchair. So they do not have that modeling, and often little or no training is provided. So compared to our typical population, this is our situation for a lot of kids. We need to remember that context and get in there and provide that training. So we might start off by doing some training of mobility concepts, more of the cognitive aspect of this task. Some clients are going to hop in and take off, despite all these limitations, despite their lack of modeling. That's great, terrific. Our mobility training may not need to be that long. Other clients on the other end of the spectrum are going to require extensive and long-term training in order to be successful, but can still reach that level of success. And then, of course, many are in between. In general, here's some tips for training kids. First off, when I'm working with a child, I really provide minimal instructions. Now, I know I'm talking to you a lot here today, but when I am sitting down with a child who's first starting to learn, optimize their driving of a newly received power chair, I give very simple, short directions. A lot of the clients I work with have processing delays to boot, and if I launch into a big, long lecture, it's very, very difficult for that client to process all that and then apply it. Kids really do learn best by trial and error, and so I just want to get them moving and help them out from there. I also aim for large, quiet environments, like a big old empty gym. It's sometimes really hard to find an empty gym during school days because so much is going on in that room during the day. But if I can find a large, quiet environment, it's very similar to starting off my teenager driving. That teenager is going to start driving preferably in a very quiet, very deserted parking lot on a Sunday afternoon, not on the freeway. And then we slowly change up the environment. We increase the requirements as the driver, either of that motor vehicle or of a power chair, slowly accommodates to the task. Now, some people will say, what about driving in context? After all, this driver has to drive in other locations besides a deserted gymnasium. They have to be able to drive through the school, for example. Well, for school-age children, driving in a crowded hallway is equivalent to a teen starting driver's training on the freeway. It really is. If you've been in a busy school lately, and hey, most of them are pretty busy, it can be rather intimidating to get through these crowds. And if you're in a power wheelchair and you're still learning how to drive, it can be really, really stressful. So we start slow. We move up in difficulty through other environments. So again, we can start with an empty gym. Then we can move to a gymnasium that has just a few children in it. I have been known to go to the classroom and ask for a couple of volunteers and bring them into the gym. Sometimes I'll ask those other students, those peers, to just even stand still. My client might get very, very excited, perhaps not drive as well for a few minutes, but hopefully accommodate to the novelty of having some other people in the gym. Then I might ask those students to just walk around a little bit. We're slowly helping this client to move through a variety of environments. I can move from there onto an empty hallway, kind of similar to moving from the parking lot to a quiet street with your team, then a hallway with a few kids, and then eventually a hallway with a whole bunch of students. Before we start our mobility training, it's really important to make sure the client is positioned well. It might be that the seating that they have is not optimal, that some changes need to be made so the client has adequate stability to use their body well. It might be they're just not placed within their seating system well, so make sure they're in a good position and have the required support. It's also important to make sure the client's using an appropriate driving method. Now, if they've recently received this chair, hopefully the evaluating team has put a lot of work into that and has chosen the appropriate driving method for the client, but important to verify this is what they can actually control. For mobility concepts training, we're going to work on stop and go, directional, problem solving, and judgment. Again, this is most often required with kids, but these strategies can apply to all ages. For those of you who joined us on determining or developing readiness, you might think, wait a minute, we've already talked about this. But when we are helping to develop readiness for a client that doesn't yet have a power chair, for whom we're preparing for a power wheelchair evaluation, we're developing these concepts. For someone who already has their power chair, they should have these concepts. We're helping them perfect these concepts and skills in their own power wheelchair base. We can do this in context. We can also do this by pulling the child out of the classroom and working on some of these one-on-one. If we pull the child out of the classroom, once they're in that power chair, perhaps in that nice, big, quiet, empty gym, we can have the child go and stop on verbal command. So simply, I can explain this to the client. We're going to practice driving in your new chair. When I say go, make the chair go. Push your joystick, press the switch. And when I say stop, stop as fast as you can. And we want to keep this really fun. These are kids. We don't want this task to become a negative one. I don't wear a lab coat and hold a clipboard. I try to relate well to the child. That means I have to sometimes keep up on the latest cartoon characters or Disney movies to keep that conversation going, build that rapport. I want this little person to be as comfortable as possible so they can do their best. I also will explain briefly why stopping quickly is important for safety, because this client may not realize that. So I can let them know we're working on you stopping really fast because that'll help you not run into things. And I might even tell the client, hey, running into things can be fun, but it can hurt something or it can hurt someone, and we want to not do that, just like mom or dad have to stop the car. We can play games because kids are all about playing. For good pediatric therapists, we know that a good pediatric therapist might not look like they're really doing therapy at all. They might look like they're just playing, but it's highly directed play. And we can play games such as red light, green light. It's an old game, I know, but kids love it. This is where sometimes bringing in a few peers can be helpful and having them play along too to see who can stop quickly. Our goal, again, is to stop on command quickly. What about in context? What about as a part of the school day? These kids are really busy and it can be hard to find time to pull them on out. Well, let's say the class is moving from one location to another, perhaps from the classroom to the cafeteria for lunch. You can walk next to the student and encourage them to stop and go when appropriate. Often I place the student behind the rest of the class with a little bit of lag so that they're not likely to jam someone in their calf. We want to keep everyone safe, but allow them to do some practice in context. Again, keeping it really positive, keeping it as fail-safe as possible. If we stay calm, the child generally will stay calm. If the situation gets too stressful, if it gets a little too chaotic, too loud, or it's not feeling very safe, downshift. The client may not be ready for that environment yet. Maybe they're not ready for a hallway full of kids changing classes. We can downshift to those quiet, large spaces and then slowly advance to the other environments. But it's important to be insanely calm. That's hard to do when we were teaching our teenagers how to drive a car. Really hard to do. I'm amazed at people who get paid to teach teenagers how to drive a car day in and day out. I think my blood pressure would go off the charts. But those folks excel at being calm, don't they? They have to be calm. Because if they freak out and yell at that teenager is likely to hit the wrong pedal or turn the wrong direction. Very important to stay calm. Directional concepts. Directional concepts, if you've joined us for these other webinars, is understanding that depending on the direction I move the joystick or which switch I activate, the chair is going to move in a specific direction. So in the power wheelchair, we ask the child to move in an indicated direction. They should already have directional concepts, but now need to apply it to their own power wheelchair. This gives the child an opportunity to discriminate between those directional switches or joystick movement. Now, the client does not need to understand left and right. Phew, that's a good thing. But they do need to understand that if I move the joystick kind of towards my left side, that's where the chair is going to move. So you can choose what language, what labels to use as a team, but the child doesn't have to understand the terms left and right as long as they understand how to move the chair in that direction. Again, we can play games, and Follow the Leader is a really helpful game for directional concepts, for practicing these, because I need to follow somebody. I need that leader to be okay with moving rather slowly and carefully so they don't get run over. And sometimes it helps if I'm in a clinic situation and we have some other power chairs laying around. I might hop in a power chair myself, provide a little modeling, and say, come on, follow me. That can be very helpful for a client to practice their directional control. What we want to avoid is saying, push the blue switch, push the red switch, push the yellow switch, because that only tells us the child knows their colors. We want to say, come on over here, and see if they can choose the correct switch or correct movement of the joystick. Bringing in peers can be helpful too, as the client can handle, again, the novelty of doing that. As a part of the school day, again, the student can follow the rest of the class with some supervision as they transition between different areas. This is an excellent opportunity for them to practice directional concepts. Which switch do I hit to continue following my class? Which direction do I move the joystick? Tip time. Common problem. What if a student hits the wall? The power wheelchair can be programmed to stall out when the chair bumps a wall. Now, it won't have a lot of power. There's a couple programming parameters that can be adjusted at this time. Now, you probably don't have a programmer, or you may not be familiar with programming a power chair. That's okay. You can work with the complex equipment supplier or the manufacturer representative for that brand power chair and say, hey, I need you to turn down some things in the programming so this chair is not going to hit the wall with too much force, enough force to cause damage. Two of the programming parameters they'll most likely turn down include power and torque. Both of those can be turned down, sometimes in a specific drive. So maybe drive 1 is the drive the client uses indoors. It doesn't have as much power. Maybe it's at a slower speed. Out on the playground, where maybe more power or torque is required to move through something like grass or just uneven asphalt, you can have a different set of programming parameters. These power chairs, even a very small one, are very heavy, about 250 pounds. They have a lot of power depending on how they're programmed, and they can pop a hole in that wall. They can move furniture, and if the chair hits the wall at just the right angle, some of these are literally capable of starting to drive up the wall. That's not something we want to see, so we need to turn those down. This is a time where it's important to stay calm. If the client bumps into a wall, don't worry about it. Calmly redirect them to choose another direction. All right, we have a question here, so I'm going to stop and answer that. Allison has asked if a student currently has a manual chair or is used to a manual chair and very new to a power wheelchair, would you do these activities, such as stop and go game in the gym, with the manual chair? As an SLP, I'm thinking the student experiencing that movement without demands of controlling the power chair would first solidify the meaning of stop versus go. So, Allison, great question. And you have also asked if that was part of the last webinar, and absolutely it was. So in pre-mobility training, what we talked about is much of this can be done in a manual chair. What I do is when the client presses a switch, which represents a certain direction, I move them in that direction by pushing their manual chair. So the switch isn't plugged into anything. It gives me good control of the situation, helps the client feel safe, and allows us to start practicing without having a power wheelchair available. So absolutely, it's a great strategy. It's one I use all the time. But once they do have their power chair, I need to start using that and optimizing their skills. The exception to that would be, let's say someone has recommended a power chair for a child. They seem to really be struggling with the task, and I think maybe we need to back up and rebuild some skills. Then I might downshift into manual chair, but usually I'm going to start with that power wheelchair. All right. Oh, and someone's asked too, where can we access the pre-mobility webinar handout? I'm sure Deb will put some information in the comment box for everyone about where you can access the on-demand library for AbleNet University. There's a whole bunch of webinars you can watch, including the pre-mobility one, and they're all now on YouTube. Okay, so the next concept that we're going to work on is problem solving. Again, we can pull the child out of the classroom to work on this. So in the well, let's define problem solving first for those of you who were not in some of our previous webinars. Problem solving in a power wheelchair means that in order to get from point A to point B, I understand which switch to activate and for how long and in what combination to get from point A to point B. Or with the joystick, where to move the joystick, how long to hold it in a specific direction, and combine that with other joystick movements for set determination of time to get from point A to point B. So we now want the child to do something more than just go in a straight line, right? We want them to have to complete a more complex course. And this requires problem solving. And problem solving requires time. It just takes lots of trial and error and practice for the clients we work with. Many clients we work with take the long road home. They take the scenic route. That's okay. Every time they're hitting the switch, they're learning. They're getting a response. And those long journeys will start tightening up with more practice. So I want to indicate to the child a location in the room that requires more than one directional command to reach. I don't want them to just push the forward switch or push the joystick forward and whoop, there I am. That doesn't really require problem solving. At this point, our goal is not developing so much the concept of problem solving, but to develop accuracy. So we can play some games again. Follow the leader is a great game for this, so is hide and seek. We need to make sure that whoever's hiding isn't hiding too well and is very patient as the client slowly makes their way towards them. You can pull in peers for this to make it more engaging for your client, as long as their skill set doesn't regress too much with that excitement. As the child progresses, we can move on to more realistic situations. And for a power chair, that would include going down hallways, going through a doorway, going in and out of a bathroom, going outside on the playground. But we want to do so slowly. I'm an OT. I'm a big fan of breaking down the task. Some of our kids, like I said, they can hop in and take off, and they're fine. But a lot of the clients we work with need us to really break down that task into baby steps so they can really build the foundational skills they need to be successful. So in looking at problem solving, we might want to start driving through a straight course. So as the client moves along, all they have to do is kind of try to stay somewhere in between these lines. As the driver improves, we can make the course a little longer. We can also narrow it up. So we might want to start with something that's nice and wide to account for some of this veering around and narrow it up. We can then move on to corners. So we can mark out a course as a 90-degree turn. Now there's a couple ways you can mark this out. You could do so with tape on the floor. But for clients, sometimes they may not be able to really see the tape on the floor very well. You could try putting some cones around here, but it might be hard for the client to always know, well, where exactly am I supposed to be? You could actually use a hallway with a 90-degree turn as well. But use the various strategies you have, use the props that you have in your environment to create a 90-degree course. You can start wide and then get a little more narrow. Have the driver go through the course and work on that turn. And you can have them turn around and do it the other way so they can work on left and right turns. For someone using switches, this means I need to give a forward command, stop, and give a right command, and vice versa. For the joystick, I need to move the joystick in that general direction. Now this is the challenge with power wheelchairs. If I give a forward command and my front casters are not completely biased forward, maybe they're skewed to the side because I just completed a turn, my chair's going to pull off course a little, and I have to keep compensating. So a lot of our drivers will end up driving like this. especially if they don't have something on their chairs called tracking technologies. If you're working with a client who's getting a new chair, make sure you recommend to somebody who's going to be evaluating this client to recommend tracking technologies. It's optional and it has to be justified, but it keeps the chair on a straight course. Despite changes in the flooring or whatever the surface area is, that chair is going to be more likely to hold a straight course. That means I don't have to compensate as much with additional switch hits or movements of the joystick. Then we move on to curves. We do this after corners because curves is actually more difficult than just turning 90 degrees. So again, we can mark out a course somehow in a way that makes sense for this client and have them slowly move along and make these more subtle curves, not 90-degree turns, but just some curves. We can again narrow the course as the driver improves. So don't start too narrow and see how they do. Problem solving as a part of the school day means, again, driving in context. So we need to think of some activities, some tasks that can help us work on problem solving, but be meaningful to the client. So for example, maybe the student can deliver attendance to the office if they do that anymore. It's probably all digital or other papers, anything that has to go to the office. They can problem solve, getting around obstacles, figuring out how to get there, and you can be there with them, helping them out. When the class moves to a different area, you can have the student try the following. Maybe go through the classroom door without assistance. Maybe go down the hallway, go in and out of the bathroom. So as this client shows increasing competency, we're going to continue to address problem solving. Again, remember, the average teen has normal cognitive, sensory, and motor skills. The average teen has had many years of modeling, and they put in 40 to 50 hours of supervised driving before they're even allowed to take a test. So it takes time. And the clients we work with, it's reasonable to assume, may not achieve competence until they have met the requirements of a typical teen. So their competence may take even longer than 40 to 50 hours. It doesn't necessarily mean this child won't get it or won't be successful. We just have to allow for adequate training time for this person to gain these skills. Judgment. Judgment is a tricky one. Judgment is recognizing a time where I need to slow down, where I need to change my course, where I need to stop. And if I don't, there could be a consequence that's not desirable. I could run into something, someone, go off a curb. I'm convinced that many of the clients we work with are lacking in judgment. The reason is lack of experience. Think about your typical preschoolers. They're running around. They run into each other. Ow, that hurt. I just clonked my head with hers. I don't want to do that again. And they slowly start developing some judgment, some caution through experience. I race around. I clonk my head on the edge of the coffee table. Ugh, that hurt. I don't want to do that again. So I start avoiding the coffee table. But until I run into it that first time, it's unlikely that I recognize it's a hazard. Same with the clients that we work with. So by the time we actually provide a power wheelchair, this client needs opportunities to start developing judgment. So first we need to remember that many of the clients we work with, even if they've just received a power chair, may be sorely lacking in judgment. So we need to keep our expectations realistic and work on slowly developing these skills. So I can place obstacles in their way to see if they'll stop or go around them. This is tricky because some kids really like running into objects. I don't want to put grandma's china cabinet in front of them, right? But if I put a big old bolster with a teddy bear on it, that's awful fun to knock down. So this can be a difficult thing to come up with something that encourages the child not to run into it. As we continue working on developing judgment, we can move on to more real-life situations. And where this gets really higher stakes is outdoors. And training a child to drive outdoors is something that should be done generally after they show a great deal of confidence indoors. There's a lot more hazards out there. There's curbs, there's drop-offs, there's potholes, there's gray gravel next to gray sidewalks, next to gray curbs, next to gray streets, and it can be hard to discriminate between those. So I work on judgment for a while, generally, before I get working on anything outside. So what do we do during the school day? Well, fortunately, children in particular are very motivated by rewards. At least most of them are. They'll do almost anything if they can get a ribbon or a sticker or a check mark on a chart. And so if we can help provide rewards for safe driving, sometimes this can be very motivating. So maybe at the end of the day, we say, hey, did this client hit anything today? Were they a good driver? Were they a safe driver today? If that's the case, then maybe they get a reward for safe driving. Depending on the client, that reward might have to come more frequently than at the end of the day. Maybe if you've done really well this last hour, we're going to give you a nice check mark on your chart. Important to keep it positive. Again, many of the kids we work with do not have opportunities to develop judgment, and we need to help them with that. Once the child's ready, we can work on driving outside, but this can be tricky. We need to generally start with sidewalks. Sidewalks can be hard because it's very important that the client recognize the edge of the sidewalk. And from a visual standpoint, that can be tricky to discriminate. And if the client goes off the sidewalk, that can be hazardous. Their tires can get stuck in gravel or go off the edge of a curb. So depending on the client's visual abilities, this person might need a certain level of supervision outdoors. We can work on going up and down ramps or managing curb cuts, managing door openers, and managing non-accessible situations. What happens when there's no power door opener? What are our options when you're driving a power wheelchair and there's no power door opener? What if there's no curb cut? So if there's no curb cut, one option might be I need to turn around and go back to a driveway, and I might need to drive in the street for a little bit. I have to ascertain if that's safe, depending on where I'm located. What if there's sprinklers up ahead? I don't want to go through those. It could break my power wheelchair. So there's a lot of potential hazards, a lot of problem solving that's required with driving outside. All right, let's take a break for a moment and see if folks have any questions before we keep moving through this material. We have a lot of people on this webinar, and I can always count on this group to have a lot of great questions and comments. So I'll just give people a moment to type those in. While people are typing, after we take a few questions, we're going to talk a little more about a few other mobility suggestions, other ways that we can help train kids, and talk about some specific scenarios that might come up, especially in a school setting, and how to address them. All right, Heidi has asked suggestions for teaching students to stay on the right side of the hallway. Okay, so perhaps the class is trained to walk on the right side of the hallway so that people coming the other direction can get by. I would first make sure the client develops some competence with just moving down the hallway without people around. And once they're able to fairly successfully navigate that hallway, I would start working on, hey, in our school, we try to stay on the right. You could even put some tape down the middle of the hallway and work on staying to the right side of that. You could put other types of barriers, like some chairs or some tables, depending on how much furniture you want to move. Say we're going to stay on this side and help them practice that. Okay, any other questions or comments at this point? All right, Allison has asked, who are these services usually provided by? Who pays for it? Are school districts required to provide this extensive intervention? Is it something that medical insurance covers as part of getting the power chair or afterwards? We're going to talk about that actually in just a moment, so hang on to that thought, because who's going to do this is quite important. Okay. Not seeing any other questions right now. If you are still typing, please do, and I will be answering those in just a few minutes. We do have a newer option that's available to us for mobility training, and that is virtual reality. Now, over the years, a number of people have tried to develop various computer programs that would allow someone to use an older style, almost like an Atari joystick, to move through environments on a two-dimensional computer screen. But the research showed us that doing so wasn't translating over very well into the actual experience of driving. Virtual reality is an emerging area of practice, and so research is somewhat limited, but there has been some research on this, particularly on how it impacts power wheelchair usage. Since virtual reality is a multi-sensory, more immersive experience, research has shown that people who are successfully able to navigate environments that they see and experience through those goggles are better drivers. It does help. So there are some options available that allow someone, while the chair is not moving at all, to experience movement. So while the child or adult is sitting in their power wheelchair with their power wheelchair driving method, as they activate that method without the chair moving at all, they move through virtual environments. One of these is available through Stealth Products, and they have 3 different levels of environment. The first is a gymnasium, and there's various stages of moving through this empty gymnasium. The second is a home, and the third is outdoors in a forest. This can be really nice because the client can practice with just about anyone as long as they know how to use the virtual reality system. They don't have to know a whole lot about how the power wheelchair works. You don't have to worry about the gym being empty. You don't have to worry as much about safety initially. Now, not all clients are going to be able to tolerate the level of immersion that wearing these goggles involves. It can be difficult for some clients. It can lead to motion sickness, and it's a little unclear yet how someone would interact with this if they have some visual issues, particularly cortical visual impairment. It's hard to know how the brain's going to interpret these experiences. It is possible to take the goggles off, put them down, and have someone watch the computer screen. It's still very immersive, much more interactive, much more three-dimensional than our older computer program options, and I think still can be very effective. So I include a YouTube link here. You can get more information by watching that video or by going to the Stealth Products website and looking up virtual reality. All right, we have another question from Rebecca, and she has asked about a child who has cerebral palsy, who has cause and effect and understands stop and go, but not directionality in an empty hallway. They can go about 10 to 20 feet forward, then reverse, and then they run into a wall. They're not getting the concept of backing up, and they get very frustrated if you try to put your hand over their hand. This child's in 3rd grade, can't propel a manual wheelchair. Is this a student who can still learn power mobility skills? Rebecca has said that they've worked about 10 to 12 sessions between PT and the teacher. Absolutely, I would not give up at this stage. Um, Rebecca, if you can type in the chat box there whether this is the child's own power chair or if they're using one to practice in. What I would recommend is that you go back to our Developing Readiness Pre-Mobility Training webinar and look at some of those suggestions if you haven't already, and try those in the child's manual mobility base, whether it's probably a manual chair. I see, thank you, Rebecca. So this is a trial power chair. So I would practice in the manual chair where you have more time. You don't have to worry about how long you could borrow the power chair. You have a little more control over the situation. Really try to keep things positive and consistent for the child. With pre-mobility training, I think it's very important to have frequent short sessions, ideally like 20-minute sessions 5 days a week instead of a marathon session once a week, and build those skills. But yeah, don't give up. I would work on these skills, maybe see how you need to break down the task for the client using those strategies. Thanks, Rebecca. Now, a big concern that folks have, rightfully so, is student safety. When we train in context, particularly, this increases the risk of the client bumping into walls and, more concerningly, other students. So what do we do about this? Well, it's important that we do not start in context training around a lot of other students right away. Again, it's like learning to drive a car. I did not have my kids start on the freeway. I was terrified the moment they did start on the freeway, and we did a lot of practice before then. We start off in an easier, less demanding context and slowly move up. And again, we can work with someone who's experienced in programming the chair, like the supplier, like the representative of that power wheelchair, make and model, and ask them to change the programming, such as reducing power or reducing torque, so the power chair doesn't have as much force. Okay, hopefully this will get to Allison's question. You know, as busy school-based therapists particularly, I know a lot of therapists who have to cover a huge range of schools and students and simply don't have the time for consistent training. Again, kids do best with shorter, more frequent sessions. So what do? Well, we may need to train the trainer. So we identify someone who is willing and able to do some more consistent mobility training. We train them in a plan. We develop a mobility plan and then supervise it. Really important to check in and say, how are things going? Especially if the child seems to have plateaued. It might mean that you need to make a visit, review this plan, change things up a little bit to keep them moving forward. There is typically funding available for mobility training. There is a code, a CPT code for mobility training, wheelchair training, and you can use that. Depending on the funding source, there may be a limit, though, to the amount of visits that you're able to complete with this client. They may be receiving other therapy that's eating up some of those visits as well. So if there is a lack of funding, if there's a lack of available visits, or if there's just a lack of time, this is something that often someone else can do. In my own practice, I only see clients a smaller percentage of my time because I do a lot of other things as a part of my job. So I will train someone else and keep monitoring that plan. Very, very common strategy. But just know there is often funding available for this. This is its own dedicated treatment code. All right. Oh, and Allison has asked too, would you make an official IEP goal about mobility? Absolutely. Many of the clients I work with have an IEP goal about mobility. Part of the challenge is that people certainly want measurable things, right, about mobility, like Johnny will drive 20 feet forward without running over any squirrels. Some of those goals, I understand why they're there, We don't want to get so hung up on the goal that we lose the big picture. We need to be slowly working on improving this person's overall success in driving their power chair. We might have some measures for that, but we don't want to get overly hung up on that to the point where all we're working on is he only went 19 feet today and we need him to go 20. Because our goal isn't how many feet he can drive forward. Our goal is, can he get from point A to point B successfully? That's what we need. All right, behavioral issues. Now, students act up sometimes, right? And if they act up in their power chair, what do? Well, in general, I try and address this the same way we would a typical student whenever possible. Now, let me share a scenario with you. I have helped many very, very young kids and sometimes older kids get going with their mobility. And a behavior that I see so often that I will absolutely warn parents about it is a child who recently has gotten a power chair and suddenly hits those terrible twos, no matter how old they are. Toddlers, we know, even though it's difficult, often hit a time of separation from their parents. They're seeing themselves as a separate little person, and sometimes that involves some tantrums. No, I don't want to do that. I want to do it my way. You're not my boss. I want to be the boss. Same thing happens when they hit those teen years, right? Well, what I notice a lot of times in kids when they get their power chairs is all of a sudden they hit this developmental stage, no matter how old they are, because for the first time they might have the ability to act out. They have the ability to move away from mom or dad. And so I will warn them, your child might get a little ornery for a while. Just know this is a normal developmental stage and we will deal with it. But it means that your child is developing, and that is overall a good thing. So let's talk about a few specific scenarios. Gabriel has cerebral palsy, and when he first received a power chair and brought it to school, he was 5 and in kindergarten. Well, the school contacted me and said Gabriel was driving too fast and he was bumping into the walls. They wanted me to come to the school and take the power wheelchair away. Ooh, well, I didn't want to do that. Gabriel was actually an excellent driver, and I was concerned about what was going on. So I made a field trip out to his school, which of course was nowhere near at all where I live, but oh well. So I drove out there and talked to the principal a little more about what was going on. Well, Gabriel had more than one drive on his power chair. He used a joystick. Drive 1 was his indoor driving mode. Drive 2 was for outside, and it went faster. Gabriel was very capable of turning on and off his chair himself and changing his drive from 1 to 2. So when he was inside, he was putting it in drive 2 and zooming down the hallway. So I told Gabriel, look, you can't go in fast mode in the school, indoor driving mode only. I asked the principal, what do you do when kids run down the hallways? Because believe it or not, kids do, right? Well, in this school, they would have the child come back to the beginning of the hallway and walk. So I said, that's what we're going to do with Gabriel. So sure enough, Gabriel obliged me and zoomed down the hallway. So I told Gabriel, hey, come on back, which he did. Put it in drive 1. Now you have to go down the hallway in your indoor mode, your walking speed. And he did so with a huge grin on his face. Gabriel had gotten into trouble just like everyone else. And for the first time, the playing field was a little level for him. He wasn't upset about getting into trouble. He was kind of excited that he was able to. Some of that orneriness we see. But after that, he behaved just fine because he knew that someone would hold him accountable and say, you've got to come back to the starting line and walk. Shannon was a little trickier. Shannon was 15 and has Down syndrome, and there was a loaner power chair at the school that she had been practicing with. Well, Shannon had quite a winning smile. It was very contagious. And she had learned that if she ran into the wall and turned and looked at the people around her with her winning smile, that they would all smile too. They would laugh and she would laugh. So she was getting lots and lots of reinforcement to crash into the walls, which she did repeatedly. So I had to sit down with the team out of Shannon's hearing and said, here's the deal. If you don't want Shannon to crash, you cannot laugh when she crashes. You cannot crack the least bit of a smile. You need to calmly let her know crashing's not okay and redirect her. It was hard. It was really hard to break this terrible, terrible habit. But they finally stopped laughing and smiling. Shannon decided it wasn't so fun to crash into walls anymore and started using the chair functionally. It still took her about a year of practice once she stopped crashing into walls, but she was successful and able to get her own power wheelchair. Christy was a little more ornery yet. She had cerebral palsy, and at the time of this scenario was 14. She's a little older now. She was being a defiant teenager. She would look at you, crash into the wall, and look at you again like, what are you going to do about it? She wasn't listening to anyone. Well, I knew Christy's mom well, and I explained to her what strategy I was going to use. Mom was totally okay with it. So was the school team. So I walked out to Christy and said, look, Christy, you're a great driver. I want you to continue to drive at school. But if you crash into the wall, this isn't allowed, and we're going to have to put your chair in timeout for 5 minutes. She smiled at me, slammed into the wall, and I unplugged her joystick and walked away. I unplugged it from behind her because she was very capable of turning the chair on herself. Well, what proceeded was about the biggest meltdown I've ever seen. Tears, snot, crying, it was horrible for 5 very long minutes. After which I came back, said, Christy, don't run into the walls. You're a great driver. If you run into the walls, someone's going to unplug your joystick for another 5 minutes. And she never crashed into the walls again because she wanted to drive. And she knew that there was now a boundary. One more quick case study. Brian was about 19. He had a traumatic brain injury, and he was being aggressive with his chair, absolutely aggressive. He was crashing on purpose and had very poor judgment due to quite extensive frontal lobe damage. I tried everything. I reasoned with Brian. I tried some boundaries with Brian. Nothing was working. Well, sometimes you have to go with your gut. I grabbed a pad of paper and a pencil and said, Brian, if you run into something again, I'm going to have to write you a ticket. Well, he became very distraught at the prospect of a fake ticket and started driving just fine. I see him out in the community once in a while, and his mom still has his, quote, ticket book. If he starts acting up, she says, do you want a ticket? And he starts driving much, much better. Does he have the judgment to understand that he could really hurt someone? Not really, but hey, we've got him driving safely and continuing in his independence. If you have any questions, go ahead and type those into the chat box. And while you do so, I want to go over our take-home message. So pre-mobility training, which we talked about in our last webinar, develops readiness for that evaluation for use of a power wheelchair. Mobility training optimizes driving, and that improves our outcomes. It reduces the chance of equipment abandonment, and nobody wants that. So it is important to think about the kids that you're working with, the kids in the places where you work who already have a power chair. Even if they've had it for a while, are there strategies you can use to help them optimize their driving? Again, while people are typing any questions, I want to thank you very much. I know everyone's super busy, and I appreciate this. I really hope the information will be helpful to you and to the clients that you work with. And make sure you have my contact information if you need any further information. I've done a variety of webinars for AbleNet, including a number around power mobility, so feel free to check those out if you would like more information. We are right at the top of the hour, so if you need to hop off because you've got a patient waiting for you or an exciting staff meeting or whatever is on your agenda, feel free. I will hang out for a few minutes if people have any further questions. Thanks, everyone. All right, Katie has asked, who are your target clientele? Well, in terms of considering somebody who may benefit from power mobility, I'm really open to anyone who doesn't have efficient mobility right now. Efficient meaning maybe they have no mobility or it takes too much effort and time to get from point A to point B. Then we may need to consider a power wheelchair. So it can be quite a variety of clients. Rebecca has asked, since I'm working with the kiddo on pre-mobility skills, would insurance, such as Medicaid, pay for a power chair to continue to work on the pre and refinement skills? If so, how do I justify? You know, Rebecca, that's exactly why we did that course on pre-mobility training, because it is very difficult and not always appropriate, really, to get funding for a power wheelchair if we're not sure if this client is going to be successful. Now, I am not looking for mastery of skills before I recommend a power chair. I am looking for potential, but I will develop some of those skills before we go ahead and order something. So again, I would refer you back to that pre-mobility training webinar for suggestions on how to work on those even without a power chair. There's quite a bit we can do using other strategies. And then once the child is successfully evaluated and a power chair is ordered, then you can use mobility training to optimize that driving. If we order a power chair too early, it may end up not being successful, or we may not choose the right features or driving method. All right, and Katie, I see your comments, but I'm not. If you can clarify what you're asking, that would be fantastic. And Rebecca, I know you're asking for that pre-mobility webinar site. I'm going to let Deb answer that for you. I think she might have posted something earlier in the comments about that and where you can get to it. Holly's asked, how long have you typically trialed a power chair before ordering one for a student? I know this may be a wide range depending on each student's needs. So, Holly, again, I usually try to do as much as I can without a power chair. It's very difficult to get a power chair on loan for a number of reasons. I have to make sure that my client's well positioned so they can show me what they can do. I see a lot of clients who need alternative driving methods, so I then have to get that particular driving method, have that very customized set up, and then try it for an unknown period of time. It's very difficult to do. Suppliers just really don't have the resources to make that happen too much. Used to be a little more common that that would happen. So I try to get as much done as I can in the absence of a power chair. And then for the evaluation itself, we get an evaluation power chair, we do the evaluation, and we order a chair. From there, once the chair arrives, we do mobility training. So I rarely have a trial of a power chair any longer at all. So I hope that helps. And Katie has asked, I'm new in assistive technology. I'm wondering who I would work with. So, sorry, Kay, I'm just looking at your previous comments. So if you are working with kiddos that you think could benefit from power mobility now and you're not sure who to work with, I would contact the complex rehab suppliers in your area. Two of the largest ones are New Motion and National Seating and Mobility. They will know who in the area does these power wheelchair evaluations, and it might be helpful if you have time to go ahead and go observe in their clinics. It's a great learning experience, and if there's a client that you think would benefit from power, you can refer them to that clinic for evaluation as well. You can work hand in hand with them. If I'm not answering the gist of your question, feel free to type in some more. And thanks for your comment, Holly, and thanks for listing that link there, Deb. Great. All right, I'll see if we have any more questions about this exciting topic. I should go to our last slide too, because AbleNet also wants to thank you for joining us here today.